Hey guys, Dr. Sandy, and today we're going to talk about a serious topic, which is the issue of feeling lightheaded, dizzy, and in extreme cases, something called vertigo. So I'm going to jump into it. If you're watching for the first time, my name is Dr. Sandy. I've been practicing chiropractic over 20 years. The mission of our office is to help people naturally by focusing on the nerve system, on the spine, so they can have the highest level of health possible. So let's just jump into it. So, dizziness, lightheadedness, vertigo. First of all, I'm just going to say this. It can be a very scary feeling. Now, we've been blessed. We've been able to help patients with these symptoms, but when I've seen them, it can really shake them up. So their confidence gets affected, and it's this kind of feeling like, when is it going to come next, or like, will this ever end? And it can be a very, very scary feeling. So let's kind of touch on some of the descriptives and to kind of start from mild to the worst form of like the dizziness. So the lightest form, in my opinion, would be someone who says just once in a while, few seconds, they get lightheaded. This might be someone literally like once or twice a year. They just get lightheaded, few seconds, and they probably say, I just probably need to drink water, eat something, and we'll touch base on that as well. But this is the lightest form, and these people usually, they should be fine, and if they're not, then they should obviously get it assessed. But this is just feeling kind of lightheaded. Another thing that can happen is, let's say there's someone who's getting those sensations. Now it's like maybe, once a month, maybe twice a month, a little longer than a few seconds, maybe a few minutes. They do pull through, but this is the key thing I want to make this video about, is that you got to look for patterns. So I'll tell you something simple. Let's say you're helping your friends, you're moving boxes because they moved into a new house. You're sore for a couple of days and it goes away. I think the body's able to get through something like that. But let's say you have an issue, whether it's pain or dizziness or numbness or tingling in your body, and it keeps showing up. Like, I'm talking weeks, months, or even years. Your body is saying it needs help. It needs some outside assistance. I would obviously recommend going natural first, conservative. And another thing I want to teach you as well, if you have any health issue, go after it aggressively in the early stages. If you kind of deny it, ignore it, hope it's just going to go away, it may just get worse and worse and worse. And then it may be very hard to heal, correct that process. So I would say that be on top of your health. Obviously, if you feel like you're okay, you would know that, but just be aware that if something keeps reoccurring, don't ignore it. Get it assessed, get it professionally assessed. If something keeps showing up, the body's saying it definitely needs help. So we talked about, someone could feel lightheaded. Now let's say it's getting a little more frequent. They might even have feelings of like they're going to fall. That's obviously starting to get more serious. They may have feelings of motion sickness. So now they feel like they may throw up, nausea. They may actually throw up. Another thing that can happen is a feeling of like wobbleness, like almost like a disequilibrium, where they just feel like when they're walking, they may fall down or they feel wobbly. And if you were to look at them, it looks like someone who's had alcohol and, they've had too much to drink. They haven't had any alcohol, but it looks like that. And they just don't feel coordinated. They feel very wobbly, would be the best word. And then the most extreme case would be, high frequency. Now it's happening several times a week. It's lasting for a long time, maybe minutes, half an hour, like long episodes. And in the most extreme case would be something like vertigo. So vertigo is now like, when I've talked to my patients, and we've been blessed, we've been able to help our patients. Now they feel like the room is spinning. It's severe. And what I've usually heard, these patients will say that when they lie down in the bed and when they get up from the bed, or if they're in the bed and they turn their head, it kind of triggers that response. So they have to be very careful. So here's a tip until you get it resolved. You can be seated in the bed and try to, I know it's not the most comfortable thing, but I would sleep at like a 45-degree angle so you're not going horizontal. It seems like when you're horizontal, that seems to really trigger those episodes. So something you want to be mindful of. And in extreme cases, they may get the vertigo, the extreme dizziness, things like that, and then they may get a headache. And then the big thing is they might feel just wiped out and just really tired, very weak after that episode. So obviously this needs to be professionally assessed. That's not a normal situation. So let's jump into some of the causes. So one thing that could be affected is the inner ear. So if the inner ear is just not working the way it should, if it's just not firing and operating the way it should. You know, the inner ear, if you look at it, that's your balance system. That is how the brain, the visual system, the balance system, they're all talking to each other. So we want to make sure that everything is healthy as possible. But yes, if the inner ear is not working the way it should, it can obviously affect function. What else can affect it is things like low blood pressure, low blood sugar. These are things that can impact it as well. So we want to be mindful of that. Dehydration, not drinking enough water can obviously cause things like feeling lightheaded, dizzy, things like that. More severe cases, if someone has a history of challenges, health issues with the brain or the heart, that can obviously affect function and cause balance issues and dizziness issues as well. And the big thing I want to talk about, which maybe people make the connection, maybe they don't, is anxiety and stress. So if someone is constantly stressed, if someone is constantly feeling anxious, what can happen is it can affect their balance system because it's just an overload. And I'm telling you again and again, I think a lot of health issues are related to stress. Too much stress can cause headaches and migraines, pain in the body, inflammation in the body. It affects sleep rhythms, it affects energy, digestion, and yes, it can also affect someone's balance. So these are things we definitely want to be aware of. As always, make sure you're taking care of yourself, finding ways to deal with stress, prayer, meditation, exercise, walking, yoga, whatever works for you. Maybe just being with friends, journaling, listening to music, but please make rituals, take care of yourself, and make sure you address stress. If you can take care of your stress, it's really going to help any health issues you may be going through. Another thing I don't want to forget about as well, post-concussion. So if someone actually bangs their head, this could be from an accident, a sports injury. They may feel dizziness as well. That could be another cause of it as well. So these are things we want to be mindful. So now let's start talking about solutions. So maybe you start to drink more water, you're addressing your stress levels, you're trying to get proper rest, you're doing things to take care of yourself. But let's say, you've been to the docs and they're saying, everything's showing up clear, but you're still having those kind of lightheaded symptoms, dizziness, vertigo as well. And you're just not sure what to do. So one thing I would tell you is that from a chiropractic perspective, one thing we look at is the upper cervical spine. So this is called the occiput. C1, C2 is sitting over here. So if these areas actually misalign, it can cause almost like a confusion in the body. And now the brain and body are kind of like disconnected. Those messages are not flowing. And then the body's perception of its environment can get affected. The inner ear is having trouble talking to the brain. The visual system is getting disturbed. So it's basically, we use the term in chiropractic as subluxation, misalignment, but basically the data is not getting through properly. And you have to realize the body's so sensitive. I'm going to use some random numbers, but let's say instead of 100% of information flowing back and forth, let's even say it drops to like 85 or 80% and that information's not getting through. So maybe someone's just feeling that dizziness once in a while, the information's not getting through. Our job in chiropractic is to make sure we have a good flow, good information from our environment, the internal environment, all going to the brain, not just the outside, but the internal environment. How is the heart? How is the lungs? Sending that information to the brain. And you have to remember the body is designed to protect you, to take care of you. It's always making sure you're safe. Are you okay? But it needs information. But if that information is scrambled, if it's not a clear signal, it may potentially show up as lightheadedness, dizziness, or even in extreme cases, vertigo. So I would suggest to you that if you do have questions, maybe chiropractic is something to look into. If you do have any questions about dizziness, vertigo, being lightheaded, and you're just not sure what to do about it, maybe you tried things and you're just looking to do something different, please call our office. If you have any questions, we'll see how we can help. We're available at 905-896-3393. That's 905-896-3393. In our office, what we would do initially when we meet someone, we do a full consult. We would take a history. We would do an assessment of the spine using, we have special computers that measure the health of the nerve system. We do some tests to see, what's going on, and we let people know if they can help. And maybe you're listening to this and you just have a general question and you want to know if we can help. So reach out to us again, 905-896-3393. If you want information on us, you can check our website, gopowerflow.com. I'll include all the links below. But we're here for you, and you can even call, text us. Maybe you just have a general question, but we're here to help. I love what I do. I get, I had a patient ask me that, people come in and they're not feeling well and they're in pain and stuff, and you hear this all day. How do you get through it? You know how I get through it? When I hear those patients turn around, when I hear people get better, it's the best feeling in the world. And when I hear people start to live their life again, get better at their job, enjoy family time, enjoy playing sports again, it is the most addictive feeling in the world. I love that feeling when people get healthy, and that's what drives me. That's why I get up in the morning, and that's why I love what I do, and that's why after 20 years, I love this. I love this. I love helping people, and we're here for you. So if you need us, 905-896-3393. If you enjoyed the video, please like, share, subscribe. Share this with someone who might need help. Share this with someone you know who's just been suffering with some dizziness and things, and let's see if we can help. So God bless you. I wish you a great summer. As I film this, it is amazing weather, so I hope you're enjoying, and God bless.